you get on the hamster wheel of lower sugars, and what we are talking about is cortisol responses and cortisol effects. When they're high and spiking, you get on the hamster wheel of shifting calories to fat and then wanting more carbs and sugars because of the plummeting sugar levels. So this is a person with high stress, adrenal issues, okay, that I think can be easily addressed when we address the fact that we calm his adrenal system, get a whole concept of this age man that's 53, that's got a lot of stress and weight issues is concerned. I'm also obviously drawing something very commonly hear me speak of here in a male, middle-aged male, because he has a little bit of erectile issue. What is this testosterone to estrogen ratio? Again, men don't make men don't make estrogen. We make testosterone, and through our liver, we convert it to estrogen. Okay, so higher estrogens block our testosterone receptor and make us fat, make us ornery, make us not happy people. Okay, so I suspect in him a little bit higher estrogen level, which we'll work on through the liver and liver support. I suspect in him possibly lower testosterone, but we'll see. Higher cortisol, we need to blunt his stress responses. We're going to put him on a more appropriate diet that helps him eat for health and kind of thriving and wellness, not just surviving and kind of fast-paced lifestyle. But he should do very nicely. The other nice thing in him is that he had already all his cardiac screening like we do, calcium scores, stress test, and that, which is important, I think, in a man in his 50s, okay, from a screening, everybody's standpoint, especially if you have erectile dysfunction, because erectile issues can be vascular, and it can be the first sign of an earlier impending cardiac stuff, cardiac events. So remember that blood supply, just as it is in the heart, is also an issue potentially in erections. So you want to, those can be correlated easily. So that patient should do very well too. The next case that we approach with a very personalized functional way, and what we do here is we had a follow-up patient in his about 45, and he almost 46. He actually is a trainer, a professional trainer at a big chain around the country. Very smart, highly educated, very dedicated, and for some reason all of a sudden he says is, I don't know why, doc, but I'm getting a belly, I'm getting fat, I'm getting midsection fat. So on his first visit, we did our whole, hormonal metabolic panel that we often do. He also had a concern about blood pressure. He had actually had, not necessarily failed, but they upticked him on his on his life insurance. Actually, he told me he was upset about $50 a month because he checks his blood pressure at home. But in white coat situations, what we call white coat hypertension, he gets in situations where stress events, offices, visits, appointments, he went to get his life insurance physical and his blood pressure was high. And so they upticked him on his premium on his life insurance because of his blood pressure. So I had him do a blood pressure log, which looked reasonable. We put him on our central aortic blood pressure monitor, which mitigates any brachial blood pressure confusion about, meaning, is it really hypertension or is it just a stress response? He did lovely. He does not have a blood pressure issue. We're going to send some stuff to his life insurance, and very likely that'll be taken off and his premium will be adjusted because I don't believe he has hypertension anywhere near hypertension. So he's very happy about that. The other thing that we discovered, though, on his follow-up, because his main goal was a lot of weight gain and fat, a little bit of achy and inflammation, but also he had a bit of kind of sluggishness, if you will. So he was found to be a condition called Hashimoto's. Hashimoto is an autoimmune thyroid condition, and this is a condition that actually you develop antibodies that attack the thyroid, okay? And I like to explain to people your thyroid's also trying to work, your gland's working, it's kicking out thyroid, but there is an antibody that attacks or attaches to the thyroid. So not only does it slowly destroy the gland, but any of the benefits of your floating around active T3 and T4 tend to be mitigated, so you're not getting the metabolic effects. So I believe in this gentleman who exercises regularly. Again, he's a professional trainer. He knows his stuff. He's very smart. He's doing the right thing dietary-wise. And he has his whole life. He's an ex-collegiate swimmer. He is actually experiencing weight gain from his thyroid, from his Hashimoto's, an inefficient, inappropriate thyroid that he didn't even know he had. And then also, to some degree, probably a little bit of a slower liver metabolism. Because the other thing that was found is that his liver enzymes were slightly up, which part of just aging, your liver is a filter. It does detoxify. It has to be efficient so we can be efficient. So part of your metabolic rate and metabolism does have to do with your liver. So we're going to put him on a good detox, clean out his liver. There's some supplements we use that are quote-unquote methylators, helping get rid of bad estrogens. And this way it frees up his testosterone, so it lowers estrogen naturally. And I think he'll lose his goal is to lose about 10, 15 pounds and get lean. I think that'll be very easy. We'll watch his Hashimoto's. I'm having him get a thyroid ultrasound to make sure that his thyroid is healthy and there's no nodules or cysts or anything that we need to observe or keep an eye on. But he should do wonderful. And again, by doing a recheck and a follow-up on his blood pressure log, and something that we have here, there's only a few in the whole state that we have, is an aortic central blood pressure monitor, which checks vascular elasticity. We've ruled out any chance of him being hypertensive or any confusion about that. So he'll do wonderful. So these are some excellent, excellent cases. I think that I think you get the gist here. And most of you out there that know me or you share our YouTubes with others. Why am I going over this with you? Well, because this is what personalized functional wellness medicine is. There's no confusion about this. We integrate the best of Eastern and Western medicine, the best of advanced care, but we listen and take everything very personally and look at it a very functional way. So when you fix your foundational systems in your body, not only do you do well, but you thrive and not just survive. So I mentioned some supplements also in my part 1 and part 2 about our programs and things that we do here. You can find the best supplements on our website, on our warehouse that you can order. And we have pretty much everything from A to Z. They are all pharmaceutical, medical grade, third-party tested, certified, good manufacturing process supplements. Anybody can use them, just use them with physician guidance. You can go to our website or our warehouse. Actually, the password is health, for you to be healthy, health, H-E-A-L-T-H. But some of those supplements I mentioned in the part 1 of this video series and now are things that can be ordered on there if it can help you. But hopefully you get the idea here. I think one of the things that's super key is if you have a healthcare provider that is not giving you the answers and listening to you and giving you some explanation or referring you to a specialist that can give you a better explanation, I encourage you and I empower you to do some research and look into a wellness functional medical approach at a personalized level. Find a provider, a doctor, a nurse practitioner, a professional though. That's very key, a licensed professional, okay? So they know the physiology, they know what they're talking about, okay? That listens and gets down to you at a cellular level. So hopefully this educates you, enlightens you, finds you well, and hopefully we can always make you better. So this is Dr. Lewerenz. Be well, Longevity Health Institute. Have a great night.